Genital herpes is a sexually transmitted infection caused by the herpes simplex virus HSV, mainly HSV2, but sometimes HSV1. It presents with painful sores or blisters in the genital area, which can recur intermittently. Transmission occurs through sexual contact with an infected person, even during asymptomatic periods. While there's no cure, antiviral medications can manage symptoms and reduce transmission risk. Practicing safe sex, including condom use, and open communication with sexual partners, are crucial for prevention and managing the impact of genital herpes on individuals' health and relationships. Herpes simplex virus HSV. Genital herpes is predominantly caused by HSV2, although HSV1 can also lead to genital herpes through oral genital contact. Transmission through sexual contact. The virus spreads through direct skin-to-skin contact with mucous membranes or open sores of an infected person during sexual activity. Asymptomatic shedding. Infected individuals can shed the virus even when no visible symptoms are present, making transmission possible even without noticeable sores. Multiple partners. Having multiple sexual partners increases the risk of exposure to the virus. Unprotected sex. Not using condoms or other barrier methods during sexual activity can increase the likelihood of contracting HSV. Immune system weakening. Conditions or medications that weaken the immune system can make individuals more susceptible to herpes infections. Vertical transmission. Infected mothers can pass HSV to their newborns during childbirth, which can lead to serious health complications for the baby. Oral genital contact, HSV1, traditionally associated with oral herpes cold sores, can be transmitted to the genitals through oral sex. Viral persistence. HSV establishes latency in nerve cells after initial infection, allowing it to periodically reactivate and cause recurrent outbreaks. Personal hygiene. While less common, sharing personal items like towels or razors with an infected person can potentially transmit the virus. Sexual activity. Unprotected sexual intercourse, particularly with multiple partners or with individuals who have a history of herpes, increases the risk. Gender. Women are generally at higher risk due to their biological susceptibility to HSV2. Age. Young adults and adolescents are more susceptible due to higher levels of sexual activity and less immune resistance compared to older adults. Immune system. A weakened immune system due to conditions like HIV/AIDS or immunosuppressive medications increases susceptibility. Personal history. Previous infection with HSV1 or another strain of HSV increases the likelihood of acquiring genital herpes. Behavioral factors. Practices such as lack of condom use, frequent changes in sexual partners, and engaging in high-risk sexual activities contribute significantly. Partner's history. Having a partner with a history of genital herpes increases the risk of transmission. Viral shedding. Even when asymptomatic, HSV can be shed and transmitted, increasing the risk of infection. Pregnancy. Pregnant women with genital herpes can transmit the virus to their newborn during childbirth, which can have severe consequences. Lifestyle factors. Factors such as stress, poor diet, and lack of sleep can weaken the immune system, making individuals more susceptible to infection. Painful sores. Small, red bumps or clusters of fluid-filled blisters that appear on or around the genitals, anus, buttocks, or thighs. Itching and tingling. Before the sores appear, many people experience itching, burning, or tingling sensations in the affected areas. Ulceration. The blisters can burst and leave painful open sores or ulcers that may ooze or bleed. Pain during urination. The sores can cause discomfort or pain when urinating, especially if urine touches the open ulcers. Flu-like symptoms. Some individuals may experience fever, headache, muscle aches, and swollen lymph nodes in the groin. Vaginal discharge. Women may notice abnormal vaginal discharge, along with the genital lesions. Recurrent outbreaks. After the initial infection, HSV remains dormant in the body and can reactivate periodically, causing recurrent outbreaks of similar symptoms. Asymptomatic shedding. Some people infected with HSV may not experience noticeable symptoms but can still transmit the virus to others through asymptomatic shedding. Emotional impact. The stigma and emotional stress associated with genital herpes can affect mental health and relationships. Clinical presentation. Diagnosis often starts with recognizing characteristic symptoms, such as painful sores or blisters on the genitals, buttocks, or rectal area. These lesions may be accompanied by itching, burning sensations, and swollen lymph nodes in the groin. Physical examination. Healthcare providers examine the affected areas to look for sores, ulcers, or other signs of infection. They may also inquire about the patient's sexual history and recent symptoms. Laboratory tests. Viral culture. A sample from a sore or blister is taken and tested in a laboratory to see if the herpes simplex virus, HSV, is present. Polymerase chain reaction, PCR test. This detects genetic material of the herpes virus from a swab of a sore or from spinal fluid. Blood tests. Serologic tests detect antibodies to HSV1 and HSV2, indicating a past or present infection. These tests are useful in confirming diagnosis when there are no active lesions. Imaging studies. In rare cases where herpes affects the nervous system, imaging such as MRI may be used to examine the brain and spinal cord. Differential diagnosis. Symptoms of genital herpes can resemble those of other sexually transmitted infections, STIs, or skin conditions. Differential diagnosis helps rule out conditions like syphilis, chancroid, or dermatitis. Partner notification. It's important for individuals diagnosed with genital herpes to inform their sexual partners, so they can also seek testing and treatment, if necessary. Antiviral medications. Prescription antiviral drugs like acyclovir, valacyclovir, and famciclovir are commonly used to suppress outbreaks, reduce symptom duration, and lower the risk of transmission. Outbreak management. Antiviral drugs are most effective when started at the first sign of an outbreak, or during prodrome, tingling or itching before blisters appear. They help in healing lesions faster and reduce pain. Suppressive therapy. For frequent outbreaks or to reduce transmission to partners, daily antiviral therapy is recommended. This approach can lessen the frequency and severity of outbreaks over time. Pain relief. Over-the-counter pain relievers such as ibuprofen or acetaminophen can alleviate discomfort and pain associated with outbreaks. Hygiene practices. Keeping the genital area clean and dry can aid in healing and prevent secondary bacterial infections. Avoidance of triggers. Stress, illness, fatigue, and certain foods can trigger outbreaks. Managing stress and maintaining a healthy lifestyle can help reduce their occurrence. Education and counseling. Understanding the nature of the infection, its transmission, and safe sexual practices is crucial for both the affected individual and their partners. Monitoring and follow-up. Regular checkups with a healthcare provider are important to monitor outbreaks, adjust treatment if necessary, and address any concerns or questions. Partner notification. Informing sexual partners about the infection is essential to prevent transmission. Safe sex practices, including condom use and avoiding sexual contact during outbreaks, are recommended. Support groups. Joining support groups or seeking counseling can provide emotional support and help cope with the social and psychological impact of the infection. Abstinence or mutual monogamy. Refraining from sexual activity or being in a mutually monogamous relationship with an uninfected partner can greatly reduce transmission. Condom use. Consistent and correct use of condoms during sexual activity, including oral, vaginal, and anal sex, can lower the risk of herpes transmission. Avoiding high-risk activities. Limiting sexual activities that can increase the risk of transmission, such as unprotected sex or sexual contact during outbreaks. Knowing partner's status. Open communication about sexual health and knowing the HSV2, herpes, Simplex virus type 2. Status of both partners can inform decisions about risk and prevention. Antiviral medications. For individuals with herpes, taking antiviral medications as prescribed by a healthcare provider can reduce the frequency, duration, and severity of outbreaks. It can also lower the risk of transmitting the virus to partners. Regular testing. Periodic testing for herpes and other sexually transmitted infections (STIs) can help individuals understand their status and take appropriate precautions. Educational outreach. Increasing awareness about herpes transmission, symptoms, and prevention strategies through education and outreach efforts can empower individuals to make informed decisions about their sexual health. Hygiene practices. Practicing good hygiene, such as washing hands thoroughly and avoiding contact with herpes source, can reduce the risk of spreading the virus.